We are back. It's episode 5 in Introductory Psychology, all about therapies and treatments. Yeah, I think this is going to be it. This is the 5th video, at least I'm going to try for it. I've started my timer, so let's do this and talk about cognitive therapy. In the last episode of Introductory Psychology with Professor Gerding, we talked about behavioral therapies. Here's what's interesting. If you watch this video, right after you watch that video, I should be able to ask you, much like I will in the final exam, what are 3 behavioral therapies? And the funny thing is, you probably just heard them, you probably listened, you even paid attention. But if you're not able to answer that question, you need to know that you have to study that stuff for the upcoming test. I'm rambling. Let's get on with cognitive therapy. I just want everyone to do awesome on this final exam. So let's talk about how we're going to think the stink away. So, cognitive therapy is a premise that our psychological issues and problems come from maladaptive patterns of thinking. If you think you're a loser, you're going to feel like a loser, and you're probably even going to act like a loser. So don't think you're a loser. It's a little bit more difficult than that, but we're going to give some very specific cognitive therapy techniques. In fact, some of them are really powerful. This episode may change your life forever, so pay close attention. This therapy focuses on recognizing your unhealthy thinking habits. Here's one of my favorites. This is Albert Ellis's Rational Emotive Therapy, the RET. My favorite cognitive therapy. It uses something known as the ABC model. The A stands for activating events, B, beliefs, and C, consequences. What the hell does that mean? Well, imagine this. Imagine I see you down in the dumps, and I come up and I say, "Hey, what's wrong, Sally?" And let's suppose Sally was just dumped. What would Sally say? "I was just dumped." Believe it or not, that's the incorrect answer. That is not why you are sad. Let's suppose you just got fired from your job, and you're angry and frustrated, and I say, "Hey, what's up, man? Why are you so upset?" Your answer would probably be, "Because I was just fired." But that is incorrect. You're giving me the wrong answers. You're just giving me the activating event. The activating event was getting dumped. Sorry, Sally. Or getting fired. Sorry, Billy. But you're skipping the B, beliefs, and the consequences are you being really upset. We need to take the time to really focus on our beliefs, because we don't. Because if we really focus on the beliefs, we'd understand why we're so upset about certain things, and we'd realize how irrational our beliefs are. For instance, Sally, you're upset because you were just dumped. I understand Chad's an amazing guy, but why are you so upset that Chad dumped you? What do you believe is going to happen? "I believe that he was my one and only and we're never going to be together anymore." And I'm not trying to insult Sally. I'm just trying to act so it's more entertaining for the listeners watching this. But anyways, say, "Okay, so what then? What do you believe is going to happen then?" "I believe I'll never be with Chad again." "Yeah, but what do you believe is going to happen after that? What do you believe your life is going to be like without Chad?" "It's going to be empty. I need him." So you believe you need him. So what's going to happen? "I guess I'm just never going to find anyone else." "So you'll never find anyone else?" "No." "So you're going to be alone?" "Yeah." "And what do you believe is going to happen next?" "I'm going to die. I'm going to die alone." Now it sounds ridiculous. And it is. It's ridiculous. But here's the scary thing that Albert Ellis has discovered is that anytime anyone is really upset, you can almost always trace it back to this irrational belief that they're going to die alone. "Billy, why are you so upset that you got fired? What do you believe is going to happen?" "I believe I'm not going to have any money." "Do you believe you're never going to have money?" "Possibly." "What's going to happen next? What do you believe is going to happen?" I won't be able to afford food or a place to live." "What's going to happen then?" "I'm going to die. I'm going to die alone." And that's what Albert Ellis said. But if we actually follow this rabbit into the rabbit hole far enough, we'll get back to our core beliefs and we'll start seeing that we're being really irrational. If you fail this final exam coming up, what do you believe is going to happen? Do you believe that your life will end? Do you believe that you're going to die alone if you fail? Because let me tell you, you won't. You can fail this class and still live an amazing life. I'm not even going to say it's going to be more difficult to lead an amazing life. You might have to change direction, sure. Maybe you have to try it again. Maybe you've wasted some money. Maybe school isn't for you. I hope it is, but maybe it's not. And if it's not for you, more power to you. The sooner you recognize what you want and what you really want to do, the sooner you can use that knowledge to empower you. So let's look at a diagram of this stuff. This diagram of identifying and eliminating your irrational beliefs. Here we go. So here's the common sense view. You're passed over for a promotion at work. That's the activating event right here. The consequence is you're miserable and depressed. But if you focus on the B part, the beliefs, you come up with this idea of I must be successful at everything I do or I'm a complete failure. Because I wasn't successful, thus I am a complete failure and a worthless human being. Is that true? Are you really a worthless human being? That's kind of irrational. That's kind of extreme. There's plenty of value there. So again, this is all Albert Ellis's rational emotive therapy using the ABC model. On your final exam, I'm probably going to ask you specifically, going back, cognitive therapy tries to do what? And the answer is going to be change maladaptive patterns of thinking. Then I'm going to ask you, with Albert Ellis's rational emotive therapy, what does it do? Specifically, it targets and tries to eradicate irrational beliefs. Again, this is all about cognitive therapy and thinking. So moving on from that, let's talk about Aaron Beck's cognitive therapy in short, really quick. So Aaron Beck says that we have a negative cognitive bias, that the biggest critic of you is always going to be you, and this can lead to distorted perceptions about yourself and events. Someone may actually mean a compliment, but you may see it as a criticism. You have all these wonderful things that happen through you throughout the day, but at the end, you're going to focus on the bad things. Aaron Beck says, stop doing that. Realize that for everything that goes wrong, so many other things went right. Oh crap, this video isn't loading appropriately? Guess what? So many other videos did. Maybe your computer's working. Maybe your phone's working. Maybe your car's working. Maybe your cancer is not working. Look at the brighter side of life and stop having this negative cognitive bias where you're selectively abstracting just the bad. Recognize the bias, test the accuracy of these beliefs, and then you'll realize that you're just getting down on yourself for no reason. The therapist usually acts as a model. So if someone comes in and says, I'm a loser, you say, you're a loser? Yeah, I can't do anything right. I can't do anything right. For instance, give me examples of what you can't do right. I can't do accounting right. All right, well, let's talk about some things you can do right. And the therapist basically holds their hand metaphorically through as they start recognizing all the things that they can do and the progress they made. One thing, as a side note, that we tend to do as human beings is we keep on focusing on the future, on things we don't have yet. The grass is greener on the other side of the pasture. We want this, the carrot in front of the horse, when realistically, we should be looking back and realizing how much progress we made. I can guarantee the you now is so much deeper and more valuable than the you just years ago. So take that time. And that's some powerful cognitive therapy for you. We also have something known as cognitive behavioral therapy. It's so simple, it's ridiculous. All you do is you take a cognitive therapy and you combine it with a behavioral therapy. So think of rational emotive therapy and think of one of those 3 behavioral therapies I taught you. For instance, take systematic desensitization, something from column A, and put it in with column B, rational emotive therapy. Put them together, combine them, you've got yourself cognitive behavioral therapy, CBT. You can get your certificate in CBT, specific training for it. It's pretty good stuff. It's the cognitive therapy plus the behavioral therapy together. It's that simple. But one last thing I want to leave you with this chapter is a question. Which of these therapies is the best? Is it psychoanalysis? Doing old Sigmund Freud and talking about your unconscious? Is it humanistic therapies? That empathetic understanding? Maybe we're going to train it away with behaviorism, or is it cognitive therapy? Which one is the best? The answer is a little frustrating. The answer is they're all good. We've researched this. But a better answer is it depends on the individual and it depends on the problem. For instance, when it comes to depression, psychoanalysis may do some good there, talking about what's upsetting you, your past, your unconscious. But when it comes to behavioral therapy, oh shoot, we're running out of time. Behavioral therapy is not that great for depression. Yeah, we're going to train you not to be sad. Anytime you're sad, we're just going to slap you, and eventually you're going to associate via aversion therapy with crying, with pain, and you won't want to cry anymore. That's not a good thing. But when we researched which therapy is the best, what we found is they're all great. As long as there is these three things, there will be progress. The therapeutic relationship has to be one of caring and mutually respectful. If the therapist comes in or the client comes in and they don't like the other, it's not a good situation. What's up, idiot? Well, this isn't going to work because you just called me an idiot. The therapist also should be able to care and be able to listen and be sensitive to the client's needs. If you're going to a therapy session and the therapist is just lecturing at you, much like I'm lecturing at you right now, that's not a good therapist. It should be an interactive session. In fact, I can guarantee you should be the one talking much more than they are. But here's the most important one, and one that will probably be on your final examination. Motivation. The most important thing is motivation. I've had clients that have come in depressed before, and after our first intake, I've said, let me ask you, do you want to get better? Their response is almost always, of course I do. I say, no. Think about it. Think about what you're willing to do and the things that may require of you to get better. Do you really want to get better? Are you motivated to? And I've had clients that have come back and said, you know what? Yeah, I want to get better, but I'm not going to do any crazy stuff. Like I'm not going to keep a diary or a journal or anything like that. And I have to tell these clients, well, I'm sorry, I can refer you, but I'm not going to be able to help you. Because pretty much the only correct answer is yes. What do I have to do? I'm motivated to feel better. Just by showing up to therapy, chances are amazing that you will get better. And that's pretty inspiring. And that's the end of chapter 16. We finished all about therapies and treatments. We talked about Sigmund Freud and psychotherapy and psychoanalysis. We talked about Carl Rogers, client-centered therapy and humanism. We talked about 3 behavioral therapies and finally cognitive therapies. Thanks for tuning in. Next time we'll hang out, I guess, because we're done pretty much with the entire semester. Have fun, everyone. Thanks for listening.